Welcome back to Valley Life. I'm Alicia Safias. Today we're talking to another one of the doctors at Fresno Surgical Hospital. Welcome, Dr. Henry Ayran.
Hello, welcome.
All right, and we're talking about spine surgery today, and it's kind of a hot topic in the media right now with Peyton Manning, and a lot of people are speaking about it. First of all, give us an overview about the different types.
Well, there are many types of spine surgery, some very complex and some rather routine. And as you're right, Peyton Manning is getting a lot of news, particularly because the Denver Broncos are doing well and he's playing well. Peyton had a spinal fusion surgery, which was one of the more common types of surgery, but there are many other types of surgery as well, both in the cervical spine and the lumbar spine, which tend to be the two most common areas affected that require surgery.
Let's talk about the spinal fusion. Can you kind of give us a layman's term idea of what happens in that procedure?
Sure. The discs, which are cushions between the vertebra, oftentimes deteriorate as a result of the normal aging process, trauma, accidents, things of that sort. And if a disc is pushing upon nerves, then it can cause neurologic deficits, loss of function, pain, things of that sort. One of the treatments is to remove the disc, to clean out around the nerves, and then to stabilize the spine. And the more common term is spinal fusion surgery. Bone graft is put in, synthetic spacers are put in, and then metal to hold the vertebra in position, which is referred to as instrumentation, which is all modern and accepted ways to treat very common spine disorders.
Now, a lot of us, when we think spine surgery, we think that it's kind of the end of the road, but that's not the case anymore. People kind of have the wrong idea about how far we've come.
Spine surgery has changed quite a bit over the last 10 years. I think that the perception among many people is somewhat antiquated from how spinal surgery was done originally in the 1950s. You could imagine a time when people were put in a body cast for 6 months and essentially their ability to be active again was markedly diminished. Now, with modern techniques, surgeries are done oftentimes in less than an hour on an outpatient basis or a short hospital stay, up walking either the same day or the next day of surgery, and oftentimes can even play professional sports at the highest levels, even with extensive surgeries like spinal fusions.
Wow, that's amazing. Give us kind of an idea about recovery. I imagine it involves physical therapy and that type of thing.
Sure. Recovery really does vary based on the type of surgery that was done, the underlying problem, the age of the individual. All of those are clearly factors. For almost every patient, physical therapy is required at some point in time. Generally speaking, for spine surgery, we start formal physical therapy anywhere between 2 weeks and 6 weeks after surgery. Therapy can last up to a month or two. The goals are really to help restore the muscular tone and return function back for not only professional athletes, but for day-to-day individuals as well.
I imagine there are a lot of people out there that have not just catastrophic back injuries that are getting surgery, but people who may have not wanted to do it in the past because it was so overwhelming and scary. Are those the type of people who also would be good candidates for this?
Yes, they are. I think in general, we encourage patients to consider surgery as a last option. There are many other treatment options for common spine problems, including therapy, injections in the spine, weight loss, many conservative measures. But for those with more severe problems, surgery oftentimes is the last option and one that can be extremely effective. It's very common for me to have patients who have an extremely negative perception about surgery, and understandably so, but many of those same patients end up doing wonderfully and look back on it and say, wow, I really wish I'd done this sooner. I'm back to doing a lot of the things that I want to do. Obviously, surgery is not 100% effective for everyone, but for a high percentage of people, it really does make a difference.
I imagine you hear those and see those success stories all the time. Are there any people that really stand out to you that have really had a life-changing event with this?
Well, I think on a daily basis in our office, we have patients who really make a wonderful recovery. For me, what's most gratifying is just getting grandparents to be active again so they can play with their grandkids, someone to be able to get back to work, athletes to be able to play the sports that they enjoy. We oftentimes ask patients what it is that they really are limited in, whether it be their ability to garden or play golf or whatever the activities. That's our goal, is to be able to get people to do those things that they want to do. Oftentimes it's not achievable, but that's our goal, and for a very high percentage of people, it is achievable.
Wonderful. And lastly, we have come so far. You spoke about that, but I imagine there's so much more on the horizon in terms of spine surgery.
Yeah, the future is very interesting. We're at a very interesting time in spine surgery. Stem cell research is just at its infancy. There's a lot of work being done to try to stop and even reverse the degeneration of the spine that normally occurs. There's a lot of new technology that's out there with motion preservation to replace discs and try to have replacements that maintain motion and the function of the normal spine.
Wow. Well, thank you so much for all the great work that you do, Dr. Ayran, and thank you for joining us.
Well, thank you very much.
All right. And Valley Life, we'll be right back.